Cuts to Medicaid and SNAP programs are coming. This is The Imperfect Dollar, and I'm Brittany. This bill isn't just a budget, it's a bulldozer through programs that feed and protect vulnerable Americans. From expanding work requirements to slashing funding, the big, beautiful bill that Trump is advocating for is going to put a red tape between people and the food they need to survive.
As President Trump's budget bill dominates headlines, Americans are facing the possibility of benefits they depend on being diminished. One of them, the Supplemental Nutrition Assistance Program, or SNAP. The bill includes substantial spending cuts for multiple federal programs, including SNAP, commonly known as food stamps. The bill cuts federal funding for SNAP by about $267 billion over 10 years. That's according to the most recent analysis from the Congressional Budget Office. SNAP currently provides food assistance to more than 40 million Americans.
Let's talk about the specific proposals to cut Medicaid spending over the next decade that may affect you and your loved ones. House Republicans propose to slash $625 billion from Medicaid over the next decade, leading to an enrollment drop of more than 10 million people. The federal state insurance program covers more than 40% of all births in the country, and about 37% of those enrolled are our children. 3 million Americans enrolled in Medicaid report that they are unable to work due to caregiving responsibilities. Now, this could be a child, this could be an elderly parent, or someone who is disabled as well in the family. The legislation approved by the House would cut Medicaid spending in part by imposing a strict 80 hours a month work requirement for adults without children or disabilities. The bill would also make it easier for states to cancel Medicaid coverage if recipients do not provide additional paperwork to show they meet the eligibility requirements. Now, what does this mean for you? If you earn more than 100% of the federal poverty level, for example, over $15,060 a year for just a single person, then states would be allowed to require copays for some services even under Medicaid. They could also terminate your coverage more easily if you miss paperwork deadlines, and even if you're still eligible. That sounds pretty horrible to me. If you have a two-person household, you cannot earn more than $20,440 or $28,207 for states that have the expanded limit to 138% under the Affordable Care Act. If you have a three-person household, you cannot earn more than $25,820 or $35,638 for the expanded state limit of 138%. The version of this bill passed by the House would prohibit Medicaid covering for non-abortion services provided by the Planned Parenthood clinics, which are already banned from using federal funds to pay for abortions. It would also limit coverage of gender-affirming care as an essential benefit under the Affordable Care Act plans, and prohibits Medicaid and the Children's Health Insurance Program from covering treatment. That could cause a lot of people to suffer. Now, you may not use Planned Parenthood, but they provide a lot of services to low-income recipients. And if their services are taken away, then a lot of low-income people are not going to have access to a couple of things, which include contraceptive services, access to birth control methods, including pills, IUDs, and emergency contraceptives. Planned Parenthood also provides sexually transmitted infection testing and treatment, screening and treatment for STIs, including HIV testing. Those types of tests can be life-saving if people get the medicine that they need if they happen to get an STI or HIV. Planned Parenthood also provides cancer screenings, pap smears for cervical cancer, and clinical breast exams for early detection of breast cancer. Those are vital as well, especially for women. Pregnancy testing and counseling, services to confirm pregnancy and provide options counseling. This way they can know early on when they are pregnant and how to take care of their bodies. Miscarriage management, medical care, and support following a miscarriage. There is still medical care and treatment that needs to be done if a woman loses her child. General women's health services, routine gynecological exams, and preventative health care. Preventative is the key word here. A lot of people need this. These services are vital for individuals, especially those in underserved communities where Planned Parenthood may be the only accessible provider. The proposed funding cuts could lead to clinic closures, reducing access to essential health care for millions of people.
Congressional Budget Office estimates that these changes could lead to 10.3 million people losing some coverage, with 7.6 million becoming uninsured altogether. One of the biggest shifts: work requirements. Adults under 65 without dependents would need to complete 80 hours a month of work or community engagement to stay covered. Exceptions would apply for pregnancy or temporary hardship, but many could still fall through the cracks. There are also new copays. Families making over $32,000 a year, that's 100% of the poverty line for a family of 4, would have to pay $35 out of pocket for some services. States like New York and California, which allow undocumented immigrants to enroll, would face a 10-point cut in federal Medicaid funding. The bill also bans funding to Planned Parenthood and blocks federal Medicaid funds for gender-affirming care for minors, including puberty blockers and hormone therapy.
Some changes are going to be made to the SNAP program too. The proposal would lower the age at which work requirements end by a decade to 54 years old. Right now, parents with dependent children under 18 years old are exempt from working, but the bill is going to lower the age to 7 years old. Additionally, the Republican-approved legislation would require states to take on more of the cost of administering SNAP and limit the ability of future administrations to raise benefit amounts. I don't understand why they would want to prevent future administrations from being able to raise benefit amounts. That could help more people. Changes to SNAP could affect school nutrition programs, as many students qualify for free meals based on whether they and their families are eligible for food stamps. The analysis of past similar legislation by the Congressional Budget Office has shown that adding new work requirements can result in more than 3 million fewer people participating in the federal nutrition program.
They are trying to cut $880 billion out of Medicaid, and there is not enough waste, fraud, and abuse to cut $880 billion from Medicaid, not even close. And so they are coming after people's health care, pure and simple. And they'll find many ways to talk about this. They'll talk about work requirements. But let's be clear what they're talking about. They're really talking about work reporting requirements. We have already seen this experiment in Georgia. Our governor has a program called Pathways to Coverage. He ought to call it Roadblocks to Coverage. We've got over 500,000 people in Georgia who are in the health care coverage gap. A lot of those folks could be covered right now if Georgia would just accept the Medicaid expansion. Instead, we've seen this program, and 20 months later, they've covered a whopping 7,000 people. That's it. 7,000 people. And so all of these are just tricks. These efforts of putting red tape up, asking people to certify their hours month after month after month, does not incentivize work, but it does a very good job of keeping working people off of their health care. And as a result of that, our workforce grows sicker and poorer, and it's a drag on our economy.
So that's what the big, beautiful bill is really about: cuts to Medicaid, slashes to SNAP, and increased barriers for people who need help the most. These changes aren't just numbers on a page, and they affect real people, real lives, real futures. If this video has helped you understand what's at stake, give it a like, share it with someone who needs to know, and hit the subscribe button so that you don't miss the next video. Check out this video next, and take care.